Good evening and welcome. I'm Sheila Balgobin, and I am the Dream Decipherer, and I help you to crack the code of your sleep and dreams so you can sleep sound and dream deep. This evening, we'll be looking at post traumatic stress disorder, PTSD, and its impact or its relationship with sleep. Now, PTSD is characterized by a chronically heightened state of arousal, or is this fight or flight sensation after a traumatic event. PTSD often gets worse over time or develops in such a way that you don't notice it creeping up on you. And that may happen over many months after a traumatic event. The disease is much more prevalent in women, though it can happen to anyone, men, women, children, and even animals. An estimated 7 million people out of 100 will experience PTSD at some point during their lifetime. The relationship between PTSD and sleep is a complex one, and those sleep problems may accompany many mental health conditions. Sleep problems and PTSD are actually considered part of the disorder. Among the symptoms that are used to diagnose PTSD include hyperarousal, in other words, in a state of heightened tension, and intrusion, which can manifest itself as insomnia and nightmares. Researchers are still trying to understand whether sleep problems precede PTSD or it's the other way around, whether the PTSD causes the sleep problems, sort of a chicken and egg thing going on there. But what's important about this is sleep is the time when memories are consolidated, as well as other important functions are going on within the body. This is the time when sleep is the time when it pulls together and makes sense of memories, specifically ones with an emotional charge, and fits new memories into existing ones. So it's a person needs sleep in order to be able to sort out and process any traumatic event. So, excuse me, sleep is important for learning as well. An important step in recovering from a traumatic event is to learn that the reminders of that trauma are not dangerous, and that it is possible to feel safe again. Arguably, it's logical to link a reduced quality of sleep to a higher risk of suffering from PTSD. But the research is not consistent with this regard when it looks at the relationship between PTSD and sleep problems. Some studies have shown an improvement in PTSD symptoms after insomnia treatment, while others have found the opposite. So, to date, it's unclear whether effective treatment for sleep problems can also address PTSD symptoms. So, what exactly is the connection between PTSD, sleep, and what's going on in the brain? What researchers have been finding is that there's evidence of multiple overlapping brain regions that are implicated in both PTSD and sleep problems, most notably the hippocampus, which is located in the deepest part of the brain. Also, the amygdala, the anterior cingulate cortex, and the insular cortex. These various brain regions are likely responsible for causing the patient to revisit a traumatic event in flashbacks and nightmares, as well as for maintaining a heightened state of arousal, or again, that fight or flight um, feeling that they're getting. Studies have found that individuals with PTSD have a faster heart rate while sleeping, indicating this enhanced flight or flight response that maintains the body in a state of hypervigilance. And not surprisingly, the hallmarks of disturbed sleep in PTSD sufferers include more light stage one sleep. In other words, the very first layer of sleep just before we drop off into a deeper levels of sleep is where they stay. So they're always listening, they're always their senses are always still scanning for danger. Now, um, a significant amount of emotional memory is processing is done during REM sleep at the deeper levels of sleep, and researchers believe that REM sleep disruptions that are seen in PTSD sufferers may be an indication that they are unable to efficiently process trauma. Now, this sleep loss may also cause symptoms such as daytime sleepiness and interfere with people's ability to cope. In other words, we become more ratty in our attitude, we make poor decisions, and even ordinary tasks such as cutting vegetables or driving your car can become a dangerous affair. But it does appear that there is some good news in all of this, and that improving the sleep pattern seems to have a corresponding effect on PTSD as well. So, what exactly happens? Excuse me. What exactly happens um, when in PTSD sufferers during sleep? How are they affected? Individuals frequently have trouble falling asleep and they awaken easily, often waking up many times during the night. And there are many people with the problem who also have nightmares. So these issues and other issues can result in disrupted and non-refreshing sleep. Among people who experience a traumatic event, those who suffer significant sleep problems appear to be more likely to develop PTSD in the future. In fact, one of the earliest signs of PTSD is sleep disturbance, which often encompasses things like nightmares, insomnia, and what a fragmented REM sleep. So their dream stage isn't continuous; it's broken during the night. Interestingly, sleep problems that precede the traumatic event may also have a role to play. One study found that people reporting nightmares before going to war were more likely to develop the problem after coming back. Once this disorder has set in, the presence of sleep problems appears to become worse or appear to worsen the PTSD symptoms. And even after treating the daytime symptoms, many people find that they still suffer from insomnia. What happens is that sleep problems in PTSD interfere with the brain's ability to process memories and emotions, slowing down the recovery process after a traumatic event. Furthermore, many people with PTSD use alcohol or other substances to try to sleep better, and actually has the opposite effect. These mechanisms will actually worsen sleep and can aggravate the PTSD symptoms as well. People struggling with chronic pain, substance abuse, or traumatic brain injury, depression, or some other medical problem face an additional barrier in getting good quality sleep. Certain sleep medications can also interfere with REM sleep because they put you asleep too deeply, which is the stage when we dream, and an important stage for dealing with traumatic memories. And if that process is disturbed for any reason, whether by natural or unnatural means, we don't discharge that stress, and it comes back and just boomerangs on us. The most common sleep problems in PTSD fall into three categories. First, insomnia, and it's estimated that 9 in 10 people with PTSD suffer with it. And this is largely due to the hyperarousal in which the person is just unable to relax. Another area is nightmares and night terrors. And this problem plagues a number of people suffering with PTSD, which leads to often awakening at night and making it difficult to get back to sleep. I mean, think when you have a really horrific nightmare, that sometimes it takes you quite a while for you to relax enough to fall back asleep. The content of such vivid dreams is often related to past trauma, with many PTSD sufferers reporting repetitive nightmares. Sometimes nightmares can be treated with something that's called imagery rehearsal therapy, in which the sufferer will rewrite the script of the dream with a less threatening version during their waking hours to kind of attenuate the strong feelings and fears that are evoked during the night. Another problem, as mentioned before, is OSA, or obstructive sleep apnea. And while it's not really clear why there's a higher prevalence of this problem among people with PTSD, it may be due to underlying factors such as the chronic hyperarousal or even alcohol use. But studies have shown that continuous positive airway pressure, or CPAP devices, work well with treating OSA in people with PTSD, and it may even help reduce the nightmares. While not as effective, another alternative to the CPAP device is maybe a mandibular advancement device, which keeps the jaw locked into a particular place so that the tongue doesn't roll back and obstruct the breathing. Now, it's clear that treating PTSD sleep-related problems, as well as the coexisting disorders such as depression or OSA, are really important when it comes to resolving the overall PTSD problems. Now, given all of that, what can be done to actually resolve the issue or getting help? There's sometimes medication may actually be necessary for sleep problems that accompany PTSD, but sometimes changing sleep patterns and habits may also be helpful in improving sleep in general. And there's several things that you can do that are low tech and can be instituted right away to help you to be able to fall asleep more easily and stay asleep. Excuse me. The first is to stick to a schedule. You can help avoid sleep problems by exercising during the day, but it's important to avoid vigorous exercise within 1 hour of bedtime, because again, that overstimulates the system and it's already subject to hyperarousal. It's also important to stick to a regular sleep schedule so that you train your brain like Pavlov's dogs. When they heard the bell ring, they started to salivate in anticipation of getting something to eat. Having a regular sleep time routine, especially now during lockdown, is important because it trains the brain that, oh, she's getting ready for bed. It's time to slow down and get ready to sleep. Now, it's important as well to pay attention to what you're eating and drinking. Avoid eating heavy meals before going to bed, but make sure you're not hungry as well. Either can disrupt your sleep schedule. Reducing the amount of caffeine and nicotine you consume during the day and avoiding drinking caffeine after lunchtime and not smoking before going to bed can be helpful again. They will stimulate the system, which is counterproductive. And alcohol, again, avoid consuming within a few hours of your bedtime because it is, even though it's a depressant, it will keep your system hyperactive in a sense. Developing healthy sleep habits is important as well. According to the National Sleep Foundation, the best time to take a nap is between 1 and 3 p.m. when the body's circadian or day-night rhythm will naturally drop. And you know that when we were going out to work, you have lunch, in the afternoon, but about 3 o'clock, 4 o'clock, people start to get sleepy. So it's taking a nap during that time can not only refresh you, will also boost your memory temporarily, and give you that a little bit of burst of energy to keep going through the day. Do not force yourself to sleep. It does not work. If you're having a hard time falling asleep after 20 or 30 minutes, get up. Just get up and try to do something relaxing. Perhaps have a cup of herbal tea, read a book, listen to some soothing music, meditate, whatever it is, but something a very gentle, quiet activity. And don't return to bed until you feel sleepy, because all you're going to do, if you can't sleep, and you're going to focus on the fact that you can't sleep, which pushes it even further away. Another thing is to try to make your bedroom a more relaxing place. Limit your activities to sleeping and making love. Everything else out of the bedroom. No Wi-Fi, no smart TVs, no tablets, none of that stuff, which can keep you awake from the blue light and the noise of constant pinging. So ditch all of that stuff and make the bedroom a place where it's either sleeping or making love goes on, nothing else. Temperature is important. Make sure that the room isn't too warm. And if you need to reduce distraction from light or noise, use things like earplugs, a white noise machine, or maybe an eye mask. And the other thing is try to relax. Practice relaxation exercises before going to bed can help release muscle tension and slow down your breathing. Many people experience worry when they go to bed at night, and learning mindfulness and learning how to separate yourself from your worries is an important factor in being able to fall asleep easily. Use of medications is should be done sparingly and under a physician's advice, and find other ways to address and process unpleasant memories and thoughts. Some sleep problems be due to a person's inability to handle stress very well. So things like journaling or seeking out support groups to limit the amount of stress, or finding some um, stress relieving activity, can help ease you into sleep. Something that people may not think about is so-called complementary and alternative therapies can also be of assistance, whether it be aromatherapy or vibrational essences, or treatment called EMDR, which is a desensitization, desensitization process that can be used to help with PTSD. And physical treatments such as shiatsu or massage can also be worth exploring, because trauma gets locked in our cells, in across the entire body. What one cell experiences, all cells experience because they're all linked through the fluid in our bodies. So, and trauma can get locked into particular places in the body. So having physical treatments can often help release the trauma that has gotten locked in the muscles and joints and what have you. And I know this from personal experience with the pain in my shoulder. I had to get rid of the trauma for the actual pain to go, even though there wasn't a physical problem that could be identified. It was the memory in the muscles that needed to be unlocked. So that's something to consider. So there you have it. That is PTSD and its relationship to sleep. And if that's something that you or others, someone you know may be suffering from, the first thing I would suggest is to speak with their doctor. But for suggestions as to holistic ways and natural ways to be able to deal with some of the stressful feelings related and sleep problems, I'm certainly here to provide advice. Thank you so much for watching and listening. Have a great evening and week to come, and I'll see you again soon. Take care. Bye bye.